Okay, thank you. Good afternoon. It's April 9th at 1 o'clock p.m. This is another update press conference that we're going to have here for the city. I do have two guests today. I'm going to call on them to speak in a minute, and then, of course, we'll be open for questions at the end. But I do want to welcome Sue Olenek from the Will County Health Department, who's being video streamed in, along with Ruth Covey from Silver Cross Hospital. Thank you for joining us today. I'm sure there's going to be some questions. And I know Joliet citizens are going to be happy to get updates, so thank you. I'll give a quick update where we're at with the city. As of this morning, we have 228 positive coronavirus cases within the city of Joliet. Those are known cases. Our Joliet Fire Department has transported 47 known positive patients. We unfortunately this week learned that one firefighter on the Joliet Fire Department has tested positive for COVID. It's believed that he contracted the disease on March 30th when he was transporting a known patient. He reported on March 31st symptoms and not feeling good. He was quarantined. I'm happy to say that he is reporting he's recovered and he is expected to come back to work next week on April 14th, so that's good news. An update on the Joliet nursing homes. Symphony of Joliet is reported, this is at 306 North Larkin. They've reported 15 positive patients for coronavirus. Spring Creek Nursing Home at 777 North Draper has reported one known coronavirus patient. And Salem Village at 1314 Rowell is also reporting one known coronavirus patient. Our hospitals, I'll start with St. Joe's and then I will hand it off to Ruth. St. Joe's Hospital has reported 44 positive patients that are being treated currently inside St. Joe's Hospital. They have 18 patients listed as patients under investigation. They are reporting 6 people have died from the virus at St. Joe's. They currently have 21 people in intensive care, and 20 of those patients are on ventilators. St. Joe's is also in the process of converting one of the wings of the hospital to accommodate coronavirus patients. And then, Ruth, I'll be happy to hand it over to you for a couple of minutes if you want to give an update from Silver Cross.
Give her a second. We have to unmute.
All participants are now unmuted.
Can you hear me there?
Yes. Thank you, Ruth.
Okay, thank you. Thank you for the update. Silver Cross is reporting we are currently managing 75 COVID patients. 54 of them are confirmed positive. 21 are under investigation. We have in our ICU, we have 20 COVID patients. We are opening up another floor to accommodate ICU patients. Our entire 6th floor now is COVID patients. Our vent utilization is very high. We're at high capacity and use of vents. We have 32 vents in total, and most of them are in use. Happy to answer any other questions. We have had 13 deaths related to COVID-19 here at Silver Cross.
Thank you, Ruth. We'll open up for questions at the end. And Sue, then, if you wouldn't mind, from the health department, giving us an update on your department, where you guys are at.
Certainly. Can you hear me, Mayor?
Yes, I can. Thank you.
Okay, thank you. First, I would really like to thank you and your staff for making this possible. I was invited the last couple of times, and just because of remote capabilities and whatnot, it just didn't happen. So I appreciate being here today. Thank you. Right now in Will County, as of last evening, we have 942 cases of COVID-19, and unfortunately, we are up to 35 deaths. Every afternoon, my epidemiologist receives a slew of testing results. Those go into our system, and so we renew our numbers every afternoon. The health department operations right now are quite different than they are typically. On March 20th, we closed our doors to the general public. We were still here, we were still operating, but we closed our doors to the general public. On the 27th, we made the decision, beginning on that next Monday, the 30th, that we were going to close our doors not only to the general public, but to our staff as well. We had received information about one positive case in the health department. Turned out to be our index case, and we kind of feared that it would go throughout the department. which it sort of did. At this time, we have 23 positive staff. Fortunately, we have 70 negative staff, and we have several inconclusive. So I think the decision to close our doors to both staff and the public was a good decision. Most of our staff can work remotely. Our behavioral health staff has the capability to do that, much of our family health staff. Administration, of course, we've all been working remotely. I and my assistant director have actually been in the building. And our community health center, which is, on the front lines as healthcare workers. They've been operating totally through the whole pandemic so far. So that's where we're at. I mean, our CD staff really works behind the scenes. Our epidemiologist, Alpesh Patel, was the individual who was conferring with providers and hospitals and approving the testing initially. The testing criteria has changed several times throughout the pandemic. We're constantly getting updated guidance from IDPH, and it's he and his group that are responsible for making sure that they're, up on the guidance and that they're providing consultation and information to everybody and anybody within the county that are asking questions. And we get a lot of questions. They've been putting in, 50, 60-hour weeks for some time now. I'm not sure what else I can tell you. There is a lot going on for us, just like for everyone else. We're still maintaining our interim service. We still are maintaining an information line. We have our hotline running. It'll be running Monday through Friday, tomorrow as well. We've been trying to keep up to date on our website and social media. And we've got a lot of constant calls that we're continually on daily with either IDPH, maybe with the hospitals, with the long-term care facilities. We've been in consultation with Symphony and those others that have cases as well. We've been working with Rural County Emergency Management Association, our agency, making sure that PPE is dispersed throughout the county. We are receiving, probably 15 to 20 requests every week from different entities around the county. So we're trying to work with IEMA to make sure, our Will County EMA, to make sure that whatever's coming in through the stockpile or through donations or whatever means are getting out to those individuals and those entities that need them. That's going pretty well from what I understand. I think no one has gotten to some real critical situations, so hopefully that can continue. I don't know, and I don't have any updated information from IDPH as far as when they think that apex might occur. Some people are thinking maybe 2 to 3 weeks. I'm hoping it's a lot sooner than that, but of course, with this novel situation, nobody can tell. I would just like to reiterate what the governor has been saying and what the president has been saying, and that is stay at home. I know the weather is getting nicer. We're having an Easter holiday weekend. A lot of people are going to want to be out or with family and friends. Please don't relax that attitude. If we can really buckle down and stay at home and continue with what we've been doing over the last few weeks, it will make a difference. It still will make a difference. So I just have one other update. Today we received some guidance updates on the Walmart and the Walgreens testing sites. The Walmart site on Jefferson Street will take anyone who is symptomatic. If you have symptoms, fever, cough, sore throat, headache, any of those, all those symptoms, then they will take anyone with symptoms. You don't have to be a healthcare worker. You don't have to be a first responder. Their hours are 10 to 4, and they're still at the 250 max for the testing. The Walgreens site on Boughton Road, they are still only testing healthcare workers and first responders and anyone 65 and over that are symptomatic. Their hours are a little bit broader. They're 9:30 to 4:30, and they also have that 250 test max. If there are questions, I'd be glad to answer them if I can.
Well, I'll get to that in a minute, but I do want to personally thank both of you for participating. I know how hard you're working, how busy you are. Thank you for taking a few minutes out of your schedule to pass this on. This is information that the public really needs to hear. So thank you. Let me finish up, and then we will open up for questions. An update on the Stateville situation at St. Joe's Hospital. The National Guard has been deployed. They have opened operations on the site of Stateville. My understanding is that the majority of the patients, the prisoners, were either sent back to Stateville or transferred to other area hospitals. So thank you, Governor Pritzker, again, and the state for getting on that, helping St. Joe's. It was a mini crisis brewing, and that problem was solved immediately by our governor. So thank you. We have continued with the conference calls, both with other communities and with community partners. We had 2 calls this morning. Just to give a real quick update on the community partner conference call, we had representatives from the Joliet Chamber of Commerce, Joliet YMCA, District 86, Joliet Junior College, Joliet Public Library, and the Will County Center of Economic Development. And just to give a feel for what was reported, the Chamber of Commerce is working on a program, a push to support local businesses. Joliet YMCA is currently closed. They have a reopening target date of May 1st. District 86 continues to hand out meals to students. I think they reported in 3 days this week, 21,000 meals were handed out. Joliet Junior College has rescheduled their graduation date. They tentatively have a date set in August. Joliet Public Library has partnered up with the New Lenox Library. They are asking for people to drop off a number of items. I'm going to read them off here with the idea that these items will be distributed to St. Joe's Hospital, Silver Cross Hospital, or Morris Hospital. Specifically, they're asking for PPE, N95 masks, procedural masks, isolation gowns, surgical gowns, disposable lab coats, Tyvek coveralls, hand-sewn masks, hand sanitizer, and bleach wipes. So if anyone any entity, business has this equipment, you want to donate it, it can be dropped off either at either the Joliet Library sites or the New Lenox Library. And again, that's going to go directly to our frontline medical people in the area. So thank you to the library. The Will County Center of Economic Development, if I can pivot a little bit and talk about finances, they reported that there is still economic activity in Will County. Specifically, the large construction projects are underway and are continuing, which is a positive, that there are people in our community that are still working, and I think it's imperative moving forward that we do what we can to ensure that. They did report some startling numbers. In the month of March, the Will County, the unemployment claims were 24,000 people in the county. And to put that in perspective, the previous high that had been recorded in Will County was 7,800. So we're about 3 times the previous high before in the last month of March. So again, I do want to thank all the community partners. And I think the reason why I included that, just to kind of give an idea, I think the shock of this is worn off. And what I'm sensing, not just in the city of Joliet, but surrounding communities and our medical professionals and our community partners, that I think we have our feet underneath us. And I think as a city and as a community, as an area, we're dealing with this problem and we're dealing with it effectively. So we have a special city council meeting scheduled for Monday. We had a meeting this last Tuesday. If you watched it, we practiced social distancing. We did not have more than 10 people in the council chambers at any one time. And there were 2 council people that were able to video stream in. We're going to continue that moving forward. The April 13th meeting will be at 5:30. That will be the public hearing on the North Point project. And then April 14th at 5:30, we're going to have a special city council meeting discussing the city's financial conditions. Mr. Guidotti gave a pretty detailed description to the council last Tuesday. I have tasked Mr. Guidotti and Mr. Jones to sit down with department heads and present a plan back to the council. We're expecting to hear that on Tuesday. So again, I want to thank those for attending and for participating, and I'll open this up for any questions if they're here. Yes.
You mentioned nursing homes. Do you have all the numbers from all the nursing homes in Joliet?
Chief?
All the reported numbers that we've been given, we feel are accurate at this point.
But have you heard from all the nursing homes, or are these just ones who?
These are just ones that have reported that they've had positive cases.
Do you have any way of knowing what's going on in the nursing homes in terms of?
We do not.
You depend on them to say.
Yes, to provide us with the information.
And can you say from a health department, is that also what you know, whatever the nursing homes are willing to tell you, or you have a grip as to what's actually happening?
Yes, thank you for the question. We actually are in contact with any and all of the long-term care facilities that have any positives. They are not licensed by the health department. They're licensed by the Illinois Department of Public Health. However, as a matter of process, they are required to work with us when they do have a positive case. Additionally, any of the positive cases that are from residents in Will County, our epidemiologists and our CD staff have access to those records. So we are able to verify information. We receive information through the state INET site.
Can you provide any information, Sue, as to how many nursing homes have cases and how many cases there are, how many deaths there have been?
I can report that. I don't have that information right now. Last I spoke to my epidemiologist about long-term care, which was, not last evening, but the evening before, we had, I believe at that time we had 6 long-term care facilities with at least one positive case, and I believe we had 2 with more than 2, which is considered an outbreak. But I can certainly get that updated and accurate information to the mayor's office, and then he can disperse that to whomever requests it.
Okay, or I can call Steve Brandy later, perhaps?
You'd have to speak up.
I'm sorry, I didn't hear that.
Or
Was it for
perhaps
me?
I can get that information from Steve Brandy, your spokesperson, later today?
Oh, certainly, you can do that. If you want to reach out to Steve Brandy, the PIO, he can have that for you as well.
And, Ruth, is there any issue in terms of access to ventilators at the hospitals in the area of Silver Cross, I guess, specifically?
As I mentioned, Bob, we are monitoring ventilator use very, very carefully. It is tight. We have some backup plans that include the use of anesthesia machines, and our anesthesiologists are willing to be here 24/7 to monitor those in case we need them.
And, Mayor, are you still at 2 cases among city employees then?
That's where we're at currently, which is a positive number. We have about 850 employees. So our first responders obviously are exposing themselves every day, and I know they're being monitored by both the police and the fire chief. They have specific orders if they don't feel good not to come to work. That's being covered by the city. So yeah, and I believe, Chief, if you can give an update on the officer, the detective who was positive.
Yeah, our detective who tested positive on the, I believe it was the 23rd of March. He's doing great. He has no symptoms. He'll be back to work Monday. He's on the 12-hour shift, so he took a couple extra days off this week to be with family. But he's doing fine, and he'll be back to work.
Any other questions? Very good. Well, again, Sue and Ruth, thank you very much. I really appreciate it. Happy Easter to you and your families. Again, I want to thank city staff
You're welcome.
for all the hard work. Our employees that are still coming to work and doing their jobs, thank you to all of them. And everyone in Joliet, there's been a lot of compliance with the governor's orders. And we stress this every time. This is something as a community, we all have a role in it. So thank you to the people of Joliet. Again, to the people I'm surrounded with, I want to wish a happy and healthy and safe Easter to everybody. We will be back on Monday. Thank you.
The host has ended this call. Goodbye.